Welcome everyone. Today I'll be presenting about a guide for families, diabetes care for adolescents with type 2 diabetes. So a little bit about myself before we begin. I am a registered dietitian. I graduated from Westchester University in 2014 with my bachelor's degree in nutrition and dietetics. I am currently a master's candidate at University of New England. I do expect to graduate from UNE in August of 2019 with a master's in applied nutrition. Since becoming a registered dietitian in 2016, I've worked in multiple long-term care centers and absolutely love it, and that's definitely where my passion lies. Some hobbies of mine include traveling. I have the opportunity to go to Jamaica in a few months, so I'm super excited about that. Other hobbies of mine include CrossFit and trying new foods, so you could definitely call me a foodie. And then on the right is a picture of me at a recent trip to DC. So some topics that will be covered today include background and some of the science behind type 2 diabetes, healthy eating, physical activity, weight management and weight loss, stress, glycemic control, managing type 2 diabetes, and family involvement. Some of the learning objectives for today, or things that you'll be taking away after this presentation, are families will be able to apply weight loss strategies to encourage glycemic control for your child, implement strategies for family involvement in your child's diabetes care, and describe the science of type 2 diabetes. So some statistics before we begin. So these statistics show why it is really important to be an integral part of your child's diabetes management. So about 193,000 Americans under the age of 20 are estimated to have diagnosed diabetes, and that's approximately 0.24% of the population. So I know that may not seem like a lot, but it was noted that childhood diabetes rates have climbed 21% between 2000 and 2009. So that means the number continues to grow past 2009. And my question is, when will that number stop rising? The rates of diagnosed diabetes by race and ethnic background are as follows. So 77.4% of non-Hispanic whites are diagnosed with diabetes. 8% of Asian Americans are diagnosed with diabetes. 12.1% of Hispanics are diagnosed with diabetes. 12.7% of non-Hispanic blacks are diagnosed with diabetes. And the highest ethnic group to be diagnosed with diabetes is American Indians and American Natives at 15.1% of the population, which is a lot. An even more upsetting statistic is diabetes was the seventh leading cause of death in the United States in 2015, which means we really need to start taking control of diabetes epidemic and stop it from advancing. To help explain diabetes, the slide describes the physiology behind the science of diabetes. So diabetes is a chronic disease, meaning it is an illness that presents over a long period of time, as opposed to acute, which happens more suddenly and over a shorter period of time. Diabetes affects the way the body processes sugar. Diabetes is a problem with your body that causes blood glucose, or also known as sugar levels, to rise higher than normal. With type 2 diabetes, your body does not use insulin properly. So with type 2 diabetes, your body is producing insulin, but it's just not using it the way it should be. So this problem is called insulin resistance. At first, your pancreas makes extra insulin to make up for its insufficiency, but over time, it isn't able to keep up. and can't make enough insulin to keep your blood glucose at normal levels. So that's definitely where the problem lies. But luckily, we can manage type 2 diabetes by eating well, exercising, and maintaining a healthy weight. When having a child with diabetes, it's definitely important to know the symptoms, which include increased hunger, increased thirst, and frequent urination. Weight loss is another symptom, fatigue, blurred vision, slow healing sores or frequent infections are a symptom. Areas of darkened skin is another symptom. And we will go over these symptoms in more detail later in the presentation. So obesity plays a big role in diabetes. As I stated before, type 2 diabetes increasingly affects children as childhood obesity increases. So shockingly, 1/3 of children in the US are either overweight or obese, meaning we are more likely to see higher rates of diabetes in adolescents or youth, since these numbers are so high. There is a clear relationship between type 2 diabetes and the characteristics such as abdominal obesity as well. Lifestyle habits like dietary modification and increased physical activity are an important factor in the treatment of type 2 diabetes. So if your child is overweight or obese, weight loss is a very important factor in the treatment and management of their diabetes. So one way to encourage weight loss, if necessary, and glucose management is dietary modification or eating healthy. The key to eating with diabetes is to eat a variety of healthy foods from all food groups. So here are some examples from each food group of healthy foods that can be incorporated into your family's meals. So for vegetables, there are two types of vegetables. They are non-starchy veggies and starchy veggies. So to start, non-starchy vegetables include broccoli, carrots, types of greens, the darker the better, peppers and tomatoes. And starchy vegetables include potatoes, corn, and green peas. Next are fruits. So examples of healthy fruits include oranges, melons, berries, apples, bananas, and grapes. And really all fruits are generally healthy. There isn't necessarily a fruit that is not healthy. Those are just some examples. Next are grains. So you want to try and make at least half of your grains for the day whole grains. And this includes wheat, rice, oats, cornmeal, barley, and quinoa. Examples of these grains would be bread, pasta, cereal, and tortillas. And all of these things can be bought in whole grain form. I know I use whole grain pasta all the time. Whole wheat or whole grain bread. Same with tortillas. And again, same with cereals. Next is protein. So lean protein is the best. So lean proteins include lean meats like chicken or turkey, without the skin is preferred. Fish, eggs, nuts and peanuts, dried beans, and certain peas, such as chickpeas and split peas. Another great protein is meat substitute, such as tofu. Not for everyone, but it is a great source of protein. And last is the dairy category. We definitely want to aim to have most of our dairy to be non-fat or low-fat. Examples of these include milk or lactose-free milk if you have a lactose intolerance, non-fat or low-fat yogurt, and non-fat or low-fat cheese as well. So, foods that should be limited that have a negative effect on blood sugars and weight include fried foods and other foods high in saturated fats and trans fats, foods high in salt, or also called sodium, sweets such as baked goods, candies, and ice creams. And a lot of these foods mentioned above come from processed foods. So, if you look on the cover of a processed food, a lot of the times it advertises 0 trans fats on the front, but if you look over in the ingredients list, it actually does contain a very small amount of trans fats, and if eaten in large amounts, it can have a significant impact on the amount of trans fats that you are eating in a day. So you just need to be aware of that. Just limit the processed foods, high salt foods, the sweets and the baked goods as much as possible. I know those are all the tasty things, but those just need to be limited throughout the day. Other foods to limit are beverages with added sugars. Also regular soda. Another thing to watch out for that should be limited is sports drinks and energy drinks. There's loaded with sugars. I suggest replacing these drinks with water. If you or your family does not like plain water, you can try adding lemon or other fruits to the water just to give it some flavor. Physical activity is definitely important part of managing your blood glucose levels and staying healthy when someone has diabetes. So if you were overweight or obese, combining physical activity with a reduced calorie eating plan can lead to even more benefits. So how much activity, you ask? Well, experts suggest that individuals aim for at least 30 minutes of moderate or vigorous physical activity 5 days of the week if you are a normal weight. So if you need to lose weight or maintain weight loss, you need to do 60 minutes or more of physical activity 5 days a week. Not only is physical activity great for managing weight, but it also has a positive effect on your blood sugars as well, which is a great benefit. One thing that you as parents need to be aware of is physical activity can lower blood glucose and can lead to hypoglycemia. So hypoglycemia also can occur after long, intense workouts or if your child has skipped a meal before being active. So to prevent hypoglycemia, it is suggested to eat a small snack with carbohydrates before, during, or after physical activity, especially intense physical activity. This would be suggested. So examples of some snacks include yogurt with berries, sliced apples with peanut butter, or really any fruit with peanut butter on it would do. Turkey roll-ups, that's kind of like a, lunch meat turkey, low sodium suggested. Maybe some cheese, turkey lettuce, tomato on there, kind of just rolled up, looks like a little pinwheel. Another great snack would just be maybe some cheese and crackers, all easy. You can take it on the go. Some quick little snacks just to make sure hypoglycemia does not happen. So there are a few ways that exercise lowers blood glucose. One way is that insulin sensitivity is increased so that your muscle cells are better able to use any available insulin to take up glucose during and after activity. Another way is your muscles contract during activity, so it causes your cells to take up glucose and use it for energy, whether insulin is available or not. Because of this relationship between physical activity and blood sugars, several long-term studies have actually demonstrated a consistent beneficial effect of regular physical activity on training. So several long-term studies have demonstrated a consistent beneficial effect of regular physical activity on carbohydrate metabolism and insulin sensitivity. So this basically just proved that physical activity has shown that it can lower your hemoglobin A1C by at least 10 to 20%, which is pretty amazing. And for those of you that don't know, hemoglobin A1C is your average blood glucose readings over about a 3-month period. So physical activity can have a great effect on your hemoglobin A1C, which is terrific. So I know exercising can be hard and time consuming. So here I have provided a list of activities that you all can do as a family and that your child will hopefully enjoy. So you can go on pre or post dinner walks. Another example is making a game out of household chores. I know a lot of kids are competitive, so that might be a great idea. Another good idea that I've had a lot of success with is that you can turn TV commercials into fitness breaks. So just choose a certain activity, maybe sit-ups, push-ups, running in place, that you all can do on a commercial break, and just kind of gets you active and up out of that seat or off of the couch during TV time. Another idea is weekly sports nights, so you can play like baseball or touch football or some other sport that you enjoy, like one night a week, which is a different way to have fun as a whole family. Another idea is to do a walk or run for charity. And this not only benefits your family and your health, but also it benefits others as well. So that's a great idea. Maybe if you have a dog, you can walk the dog as a family. Another idea is you can garden. So if you have the space, you can start a little garden and have your kids help you with that. So not only is gardening increasing your physical activity, but it's also teaching your child about the importance of healthy eating, which is great. So as stated before, weight loss, if overweight or obese, and weight management, if at normal weight, is very beneficial to anyone with diabetes. So benefits include improved insulin resistance, better A1C results, reduced risk for sleep apnea, increased energy and mood. It prevents high blood pressure and cholesterol from developing if it's not already high. So those are all great benefits. So if you're overweight and have type 2 diabetes, you will lower your blood sugar, improve your health, and feel better if you lose some extra pounds. So you might be wondering, how much weight should I be losing? So if you even drop 10 to 15 pounds, that definitely has some health perks. Some people might need to lose less than 10 pounds. Some people might need to lose more than 15 pounds. You can also go by 5% rule as well. So if you lose about 5% of your body weight, that's a good indicator of, that you're on the right track, and that you also start seeing some of these benefits. And some of the benefits and perks of losing some weight when you have diabetes is lower blood sugar, lower blood pressure, better cholesterol levels, less stress on your hips, knees, and ankles and feet. You have more energy, and you can have a brighter mood as well. So in addition to weight management and physical activity, stress management is an important factor in diabetes care. I know having a child with diabetes can be stressful on every member of the family, so reducing stress is definitely an important factor in glycemic control. So when a child has diabetes, the family's potential for stress is high, which can endanger the child's general health. Stress can actually increase blood glucose levels, which can create negative emotions and encourage poor eating. So we want to try and shy away from stress as much as possible, and reduce the amount of stress that's already there as best as we can. So some tips for reducing stress as a family include doing some breathing exercises. Another great trick is progressive relaxation therapy. In this relaxation technique, you focus on slow tensing and then relaxing each muscle group. This can help you focus on the difference between muscle tension and relaxation. You can become more aware of physical sensations. So in one method of progressive muscle relaxation, you start by tensing and relaxing the muscles in your toes and progressively work your way up to your neck and head. You can also start with your head and neck and work down to your toes if you like. You tense your muscles for about 5 seconds and then relax for 30 seconds and repeat. So practicing relaxation techniques can have many benefits, including improved digestion, maintaining normal blood sugar levels, reducing activity of stress hormones, increasing blood flow to major muscles, reducing muscle tension and chronic pain, improving concentration and mood, improving sleep quality, lowering fatigue, reducing anger and frustration, and boosting confidence to handle problems as well, actually. So aside from that, another easy way to reduce stress is to exercise. You can also replace the bad thoughts with good ones. Maybe start a new hobby or learn a craft. Maybe, like I mentioned before, you can start gardening or volunteering. With diabetes, one of the main goals is to control glucose or blood sugar levels. Glucose levels must be controlled continuously. Diabetic patients, especially those treated with insulin, are at risk for developing hypoglycemia. Hypoglycemia deprives the brain of the constant supply of glucose needed for energy. Immediate treatment of hypoglycemia is necessary when blood sugar levels are at 70 milligrams per deciliter or 3.9 millimoles per liter or below. So on the other hand, high blood sugar, also called hyperglycemia, can also affect people who have diabetes. So several factors can contribute to hyperglycemia in people with diabetes, including food and physical activity choices, illness, non-diabetes medications, or skipping or not taking enough glucose-lowering medications. Like I mentioned before, it's very important to know the symptoms of both hypoglycemia and hyperglycemia. So symptoms of hypoglycemia or low blood sugars include an irregular heart rhythm, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling sensation around the mouth, and crying out during sleep. So if you suspect your child is hypoglycemic, the initial treatment depends on their symptoms, but early symptoms can usually be treated by consuming 15 to 20 grams of a fast-acting carbohydrate. So a fast-acting carbohydrate are foods that are easily converted to sugar in the body, such as a glucose tab or gel. That can also be considered a fruit juice, it would be a regular fruit juice, not diet. Soft drinks you could use, and sugary candy, maybe such as licorice. Foods containing fat or protein are not very good treatments for hypoglycemia just because they don't contain a lot of natural or added sugars. And they won't really affect the body's absorption of sugar very much. So after administering 15 to 20 grams of this fast-acting carbohydrate, recheck the blood sugar levels 15 minutes after consuming. If blood sugar levels are still under 70 milligrams per deciliter, treat with another 15 to 20 grams of fast-acting carbohydrates and recheck the blood sugar levels again 15 minutes after. Repeat these steps until the blood sugar level is above 70 milligrams per deciliter. Once the blood sugar levels are back to normal, it's important to have a snack or meal to help stabilize your blood sugar. So this also helps the body to replenish glycogen stores that may have been depleted during hypoglycemia. So hyperglycemia doesn't cause symptoms until glucose values have significantly elevated, usually above 180 to 200 milligrams per deciliter, or 10 to 11 millimoles per liter. So recognizing early symptoms and signs of hyperglycemia can help you treat the condition properly. So you want to watch for frequent urination, increased thirst, blurred vision, fatigue, headache, and if you suspect your child is hyperglycemic, it's important to call 911 or get them to an emergency room as quick as possible, because this condition does need to be treated by qualified professionals, or it needs to be treated by an emergency room. So you should not try to manage diabetes alone. Ideally, management of diabetes should involve a pediatric endocrinologist, a diabetes nurse educator, a nutritionist or a dietitian, and a behavioral specialist. The goal of therapy is to achieve and maintain euglycemia, as well as near normal hemoglobin A1C levels. And a normal hemoglobin A1C is about below 7%. Change in lifestyle habits remains an important component in the management of the child with type 2 diabetes. A statistically significant finding was that 79.63% of patients who did not adhere to recommendations had poor glycemic control. So not only should you involve a wide range of healthcare professionals, but the entire family should be involved in care. Higher levels of family cohesion and parental acceptance have been related to better adherence to treatment and better glycemic control in youth. So improvements in glycemic control and quality of life can be increased by teaching youth and their parents strategies to manage common diabetes-related stressors. In addition, fluent family communication and problem solving improve glycemic control and adherence and reduce family conflict. To give some guidance as to when you as a parent should start giving more responsibility to your child for their own care, I have included some examples here. So school-age children, about 8 to 11 years old, can begin to assume more tasks such as insulin injections, and that's if they're taking insulin, and blood glucose monitoring. But just keep in mind that they continue to need significant assistance and supervision when making management decisions. So as a parent, you should definitely keep an eye on children of this age and help them out as much as possible. But definitely let them make some choices so that they're educating themselves. Adolescents, ages 12 years and older, are able to perform most of the tasks of diabetes management on their own, but they do still need some help with decision making regarding insulin adjustments if they're taking insulin, and also they might need some help with medications as well. So when parents give up responsibility for treatment management too early, adolescents do have poor adherence and deteriorating glycemic control. So it's important for you as a parent to be involved as much as possible in your child's care. So that's it for my presentation. But here's a recap of important points from the presentation that I want you to go home with. So first, about 193,000 Americans under the age of 20 are estimated to have been diagnosed with diabetes, and that's approximately 0.24% of the population. Type 2 diabetes increasingly affects children as childhood obesity increases, so it's very important to try and lose some weight if your child is overweight or obese. The key to eating with diabetes is to eat a variety of healthy foods from all food groups. The goal is, as much color as possible on the plate. Limit foods high in saturated fats and sodiums, also limiting processed foods. Physical activity is an important part of managing your child's blood glucose levels and staying healthy. And if you are overweight and have type 2 diabetes, you will lower your blood sugars, improve your health, and feel better if you do lose some of the extra pounds. And also, last but not least, glucose levels must be controlled at all times, something that you need to keep an eye on continuously. So does anyone have any questions? And I do want to thank everyone for sticking with me through this presentation, and I hope you all enjoyed it. And here are my references for this presentation. Thank you again.